Hi everybody, I'm Rajalakshmi and welcome to this Docemy class on nutrition. One reason why a lot of people dislike pediatrics intensely is because we have to study nutrition. And the thing is, I'm not gonna lie, it's really boring, it's quite monotonous, and at the end of the day, all you can remember are green leafy vegetables, and that's it. The rest of this class is definitely going to be a little dull in the sense that there isn't too much of a concept that I can impart to you. It is going to be more of theory. And what I would suggest is that you learn things in a certain manner, which I will talk about ahead. Learn certain concepts which will help you with respect to understanding nutrition to an extent. And we're going to cover some macronutrients in this particular session. So that's what we're going to do today. Let's start with the basics. So what are the functions of nutrition? Very simple. So what differentiates a child from an adult is growth, right? Growth and development. So what nutrition does for a child is it maintains growth and it helps in the increase of weight and height appropriately. So this is also necessary to support development because these two go hand in hand. So growth and development have to go hand in hand. In addition, it sustains vital processes like immune function, neurodevelopment, and it maintains the integrity of structures in the body. So this is epithelial structures, connective tissue. So all of this is finally dependent on the nutrition that you take. Over time, the way we approach nutrition has changed quite a bit. So we've gone from an era where you try to pump in as much as possible into a child to an era where you start thinking, after they're maybe 2 or 3 years old, you start thinking about what does go into the child and try to make it as healthy as possible. So this is a sort of a frame shift in the way we look at nutrition over time. But I would still say that most of it remains the same, and over time we've just become conscious about going towards the other extreme. So we were always worried about malnutrition. Now we're also worried about obesity. So what are the components of nutrition? So whenever you think about nutrition, so especially if you're someone who's, keen on diets, keen on maintaining yourself really well, which I would suggest you start doing now because you're in your 20s, and trust me, it just gets worse as you go along. But every time you think about nutrition, you've got to think about it in different levels. So the chief levels we think about it in are macronutrients and micronutrients. So macronutrients are the larger quantities that you consume, which you can measure, physically measure, while the micronutrients are the little minerals and vitamins which are inside these foodstuffs which go into your body or don't go into your body with you knowing it. So macronutrients can broadly again be classified as those which give you energy and those which give you fiber. Now the energy giving substances are then classified into carbohydrates, fats and proteins. You diet freaks will definitely know all this probably better than I do. And these three are the major macronutrients we talk about. We should never forget that fiber plays a big role in this. So fiber is included as part of macronutrients. In addition, I would also suggest that we include water here because we don't really have another place to put water in, and we all know how vital water is to your nutrition as well as the rest of your homeostasis. Now the micronutrients, as I said earlier, are the vitamins and the minerals. Vitamins are further divided into water soluble and fat soluble vitamins. Now how do we approach nutrition? So there has to be some way so that you can answer a question. So at the end of the day, nutrition comes to us, as students, it comes to us in two basic areas. So the first is your theory exam. You are likely to get a short note for sure from some part of nutrition. It could be a mineral, it could be a vitamin, it could be something to do with, proportions of different macronutrients. So any of these could be a short note. It could also be in your practical exam because you've got to take dietetic history in practicals. So obviously when we talk about practical classes, we'll do that more, but you should sort of have an idea in your head when you read theory, because it does not make sense to just read the theory. It has to translate into practical application. So always divide it into subheadings. In the subheadings, the first thing you should get into your head is what's the function of this particular nutrient. So what does this nutrient do in your body? And then everything makes sense because you can derive deficiency features just based on knowing what it does. So if it's deficient, that particular process is going to be affected. So you need to know the function. Next, you need to know where you can get this particular nutrient. So if you combine these two, and you combine certain chemical properties, you can then figure out how the deficiency occurs. So how the deficiency occurs is also important, because then you know where to suspect the deficiency. And finally, what does this deficiency cause? So as I said, if you know the function, you can figure this out as well. So all of these go hand in hand, but if you can subdivide it this way, it becomes easier for you to figure out what you're supposed to write, how you're supposed to remember. And I'm really not a fan of memorizing these things, but as far as nutrition goes, some degree of memorization becomes important, because otherwise you can't connect two and two. And finally, you need to know if this can be treated. If it can be treated, can it be prevented as well? And of course, as far as nutrition goes, everything is preventive. We don't want a problem to occur and then go in and treat it. Now, always remember again that there are two extremes of the spectrum. So you have malnutrition, which is deficiency of nutrients itself, but you can also have excess. So you can have under and you can have overnutrition, which would lead to obesity. So always remember that both of these ends of the spectrum occur, and you will need to apply nutrition in both of these cases. Now, let's generally just talk about what the food plate looks like. So the food plate can be divided into greens. So I'm going to fill this category name as greens. The orange one is grains. The red one is protein. The blue one is dairy. And the yellow one is oils. So this is essentially what your plate of food should look like. So it's not just you, it's any child's. And this is what you need to sort of impress upon people whenever you talk about nutrition. So at least a third of your plate should be filled with greens. So that's vegetables, green leafy vegetables, fruit. So this portion is what gives you two main components of what we were talking about earlier. It gives you fiber and it gives you the micronutrients. The grains are the portion which give you most of your carbohydrates. The protein gives you the protein. Dairy can give you protein, it can give you some fat, it can give you micronutrients as well, and the oils can give you fat soluble vitamins as well as fat. So this is how your plate should look. So as you can see, the proportion of fat is quite low. Now, how do we decide how much of carbohydrate, how much of protein, how much of fat you need? So for that, we are going to talk about some nutritional terms and then describe this further on that basis. So EER is the estimated energy requirement. Now, I'm going to say this right now. It's fine if you guys don't remember this, okay? But you should know that there is something called an estimated energy requirement. It's how we figure. So what we are looking at with estimated energy requirement is how much energy is required to sustain at least 50% of all children in that age group, right? So that's what we're looking at with an estimated energy requirement. So there are multiple methods of doing this. We have equations, we have actual methods called calorimetry. So there are many methods by which we can look at the EER. Next, you have something called the RDA, or the recommended dietary allowance. Now the RDA tells you how much you have to feed someone to meet the needs of 95% of the population. So EER met the needs of 50%. RDA meets the need of 95% of the population. So one thing you should remember here is, if it meets the needs of 95% of the population, it's likely that it may be too much for a certain proportion of that population. They may not need as much as the RDA. So the RDA goes to the upper limit. Now the UL is the recommended upper limit of intake of that particular food stuff. So it could be carbs, it could be proteins, it could be fat, it could be, iron, whatever it is. So the upper limit, so the tolerable upper limit, which does not cause adverse effects or harm to the body, is the upper limit. And the AMDR is what the dietary requirement is. So that's what we're going to look at with the AMDR. Now, in the AMDR, we can then say, so using the AMDR, we're going to talk about how much fat, how much carbohydrate, and how much protein is required for the body. So this dietary requirement is what we're going to calculate. Now, the dietary requirement of fats is more in younger children. Now, why this is because fats are essential for brain development. So because of that, you see that children who are between 1 and 3 years of age require 30 to 40% of all their caloric intake as fat. But once they become more than 3 years of age, once they go above 4 years, it becomes 25 to 35%. So there is quite a drop in how much of fats are required. What about carbohydrates? Carbohydrates, you need 45 to 65% of calories being met for all age groups using carbohydrates. So it's a wide range, 45 to 65. And protein, again, you see that as little children, they need 5 to 20 milligrams of 5 to 20 grams of protein as percentage of total calories. But older children need more because their muscle mass is building as they grow up. So in the really small age group, it's the brain mass which is increasing. As they grow, it's the bone and muscle which is increasing. Thereby, they need more protein as they grow up.
Docemy.